girl chosen Empress, and I am back with another video. Today I will be featuring
Mickelle,
and we'll be doing Dear Nurse episode 2. So let's just kick off the conversation. Mickelle, tell us about yourself.
well, I'm a nurse, a midwife, public health nurse, and a mother of 3. Hey.
She doesn't look it, right? So you said that you're a nurse. What's your journey? What has your journey been like?
As a nurse, before I actually started nursing, I wasn't just able to just start nursing because I didn't have maths. I didn't have a numeric subject. So I wanted to do nursing, but that was what was holding me back. So I decided to do the patient care assistant program. It's like a pre-training to be a nurse. It's not a full-fledged nurse, but you do a pre-training. So I was able to work and go to school and do maths and accounts. I still didn't pass maths, but I have accounts. So I applied and I got through to nursing school. I applied at all of the nursing schools and I got through. And then I'm here now.
Okay, so what's your expertise as a nurse?
Well, my area of expertise is midwifery. I love midwifery. That's really excitement, is the adrenaline rush, everything. Just new birth experience and the baby being born and awesome. Comforting the mother, being there for the mother, and that special time in her life. It's really a good thing.
Okay, so when you say midwifery, does that entail maternity care and child in terms of before labor and after labor, or it's just labor?
Everything before even the mother have the baby, so it encompasses all of that: antenatal care, postnatal care, and the child health. See the child through to 18.
Okay, so there are some questions that some viewers had asked, and some of my own personal questions. So as Christians, that we know that we cannot or we should not have sex before marriage, how do we know if we are fertile or not as a female, and how do men know if they are, I don't know, what do you call men? Fertile?
Yes, male or female
Infertility,
infertility. You have
yes,
female
right.
infertility.
So how
and
do
male
we know
infertility.
if we are fertile?
Well, alright, before you actually get married, you have preconception counseling that the couples are encouraged to attend a preconception counseling where they look at female fertility, male fertility, where they do test on the sperm to see if they're mobile enough to provide conception. Look at the lady, do any hormonal test because it could be hormonal issues why she's not able to get pregnant, or it could be something wrong with her reproductive organ where you need to get further testing or invasive procedures to be done to correct whatever the issues may be. So,
and do you think that this is very integral to persons who are maybe engaged or going towards engagement to marriage? Do you think that this is an important step that they should take?
yes, it's very important. You have to do the blood test before to make sure that you're ruling out any sickle cell traits, because you may not know you may have sickle cell, and if you or the spouse have it, that could be the child has a possibility of getting full-blown sickle cell, which would cause the child a lot of problem. And there are other genetic malformation that is there that you could maybe get counseling for, HIV testing as well, hepatitis testings to make sure you rule out all of that before you get married. So everything is plain on the table.
Okay, so for this pre-conception counseling, where can someone go to get that kind of counseling?
You can go to any area that you have your midwife or your obstetrician. You can go and speak with one of them and let them know that you're interested in getting preconception counseling. So any obstetrician or any midwife, wherever you are, you can get that done.
And yes, we know it's in Jamaica, it's not free and it's not cheap. So what is the fee, or what kind of cost that we can, prepare for that kind of counseling?
You have private and public areas. If you go to the public facility, maybe you could make arrangement and they just have a small cost. Sometimes maybe registration, you have to pay a registration fee, which sometimes $1,000 or $2,000 depending. But if you go privately now, they have their different fees, so you have to fork up some serious money to go to your private gynecologist.
Okay, so in the case that a female and a male, they're both fertile, but after marriage they're having issues to conceive, is it that you can still be fertile but not compatible with the person, and then how could you have prevented that in terms of how would you know that before marriage if you're compatible with someone or you're not?
Well, sometimes that can be challenging, because if you both are together and you're not compatible and you love your partner and you realize that after you get counselling while in the marriage and you realize that you're both not able to have children together, you can either adopt a child or you can sort about surrogacy or something to try and help with.
So it's not something that you can know before. You won't know that before.
You won't know that before. You can do testings, but nothing is really confirmative. They could be done by the doctors to test the mobility of the sperm, to look at your eggs to see when you ovulate and if the eggs are good enough to actually conceive, and the child goes through, the fetus goes through until 9 months and you see your bouncing baby.
Okay, so for a female that has hormone problems, is that a sign that they might have fertility issues?
It could be a sign, yes, because when a female has fertility issues, it could cause you delay in conceiving, but doctors could give medications to help you, the eggs to, ripen, for want of a better word, give you
So
tablets.
there are fertility treatments that are available to persons with hormonal problems or otherwise?
Yes, there is.
Okay, alright. So any other question I might not have asked about this topic that you might want to give any advice or any knowledge on?
Alright, in terms of being there, if you have a partner and both of you want children, both of you have to agree, because sometimes later down the line there are some couples that later down men don't want children or women don't want children. You have to come together as a couple before you're even married and have this discussion plain before you even start thinking about sex. When you get your testing done, you talk about children, because you can't go in and both of you not wanting children, or one want children and one don't want. That can cause problem. So you have to seek advice from before and get your testings done, and anything you're unsure about, you get counselling and you pray about whatever it is that's going on.
Alright, so for the females that have irregular period, what are some of the possible causes?
It could be hormonal issues, or it could be problems with the ovaries, because you have a polycystic ovary syndrome that can contribute. So it could be either hormonal issues, and most times it's always hormonal issues. But there are other contributing factors, but most times hormonal issues tend to cause a female to be infertile or not conceive readily. And you have to be practicing unprotected sex for 1 year before you are considered infertile.
Oh, I didn't know that.
Yes, 1 year of regular unprotected sexual intercourse to say that you're infertile.
Okay. So PCOS has been one of those cases that has been very popular now in Jamaica. Can you give us some more information about PCOS, what it is, what are the possible causes, is it curable, and so forth?
Well, from what I remember now, PCOS is something wrong with the ovaries,
Right.
So it could hormonal issues, and sometimes they say it's family history. If you have family history with that, sometimes they're looking, there isn't any family history, sometimes it just happen. So with what we eat in nowadays, so that can all contribute, because a lot of hormone things in it. So you have to just modify your diet, try as best as you can to stick to a regime that the doctor give you, to see how best that can help to mitigate against it, and do a regular checkup to see how your body is functioning.
Okay. So alright, so we're gonna switch the topic now. Alright, so for persons who want to be a nurse, like persons in high school who have a desire to pursue a career in nursing, what would be your advice to those persons?
If you want to do nursing, being a nurse in Jamaica, it doesn't pay a lot. So to be a nurse in Jamaica, you have to love nursing. You have to love it, a passion for it, to know that when you're going to work as a nurse, you're not going to get that money that you are duly deserving. So you have to love nursing. When you come into school, you have to be committed to a cause. You have to want to strive for the best, because at times you're going to be bowled over by maybe the coursework or the assignments or even the teacher, but you have to love it and you have to be committed for you to survive in it.
Alright, let's just reverse. So for you to even be accepted in the program, what kind of attributes do you normally look for when you're accepting students into a nursing program?
Right. You have to say that they're well rounded and they're articulate enough at the level that they're at, and you want to see what their background is like, to see if they're sociable, because you have to know that they're people persons. So if you're volunteering in communities or groups, we'll see that okay, you can interact well with persons. You are able to speak and deliver yourself. You're honest, have good integrity, because when you go out there and looking after the patient, your integrity is essential, because what are you saying if you did something and you didn't do it? So it starts from even before you come in.
Okay.
So all of those things we have to look on to see how you work with other peers or other persons older than yourself. We look at those things.
Okay. In terms of cost, because we know university ain't cheap.
No.
And especially for nursing, I do know that there's a difference between what a regular degree program would cost versus what nursing costs. So for a student who's looking into nursing, what kind of fees should they, start preparing for?
Okay, no, it's the cost that we were quoting. It was 5,000 US per.
5,000
That
US.
was the cost.
Was.
Yes, was the cost, 5,000 US.
And that is for the year or per semester?
For the year,
Okay.
each year. So it's 5,000 US, and it's based on the exchange rate. So right now it's $148 or something like that.
Right.
That's the exchange rate. So it's based on the exchange rate.
So you're looking at about 700 and something thousand or 800.
Yes, depending on what the US is selling for.
And that does not include books, it doesn't include
boarding,
it doesn't include uniforms or anything of the
That's just
sort.
school fee.
That's just a school fee. And what's the duration of the program?
The duration of the program is 4 years. Usually 4 years you go to school for.
Okay, so the program, is it set up that is general, or at some point in time you'll be able to select like a major, like what you'd want to pursue? Like, you have mental health nurses, you have midwives, you have the different areas of nursing. Well, talk to us about the different areas, because I don't really know all the different areas of nursing.
Okay, but first you have to get your basic training. You have to be a general nurse before
So that's
you
the
can
4
specialize.
years.
That's the 4 years.
Okay.
So you get your generalized training, and afterwards you can specialize. You have midwives, you have A&E nurses, you have critical care nurses, you have hemodialysis nurses that learn how to do dialysis.
Okay.
You have public health nurses, you have nurse practitioners, you have nurse anesthetists, mental health nurses.
And those are just a different specialization.
Yes.
And as it relates to, because here at UWISON, well, when I'm looking at the lectures and the teaching, I realize for the master's program you have different tracks.
Yes.
So that's how you divide the specialization, as in administration, what's the other one? Education and practitioners.
Yes.
And that's how, so for the specialization you would have to do that before, so after you graduate, how do you specialize after that?
Alright, so after you graduate, usually when you're at your place of work, they'll say you have to at least work at least 2 years before you're able to select an area that you go specializing in. And whatever area you're interested in, you can apply through your head of your department, and she'll send you to do the training.
Okay, so it's not something that you will do right away. You have to graduate and work for a specific number of years first. Okay, wow. I didn't think it was like that. I thought that you would be able to select. And then how soon can you actually pursue a master's degree after completing the bachelor's? Because I realize that a lot of nurses, they stop at the bachelor's level. What do you think is the cause for that? Why they're not pursuing higher education, and how long before you can actually pursue?
Okay, and move for our nurses, what I can actually say, what I see, because they have to take student loans to pay for the school fees, so they need to start working to pay back the student loan, because the longer they take, the more interest it's gonna rack up. So they have to start working.
And
to
that's 5,000
pay.
times 4.
Yes, so they have to start that. That could be a contributing factor for them not wanting to pursue higher education. But as soon as they finish the degree I know for some courses in the master's track, they have to have at least 2 years experience before they can actually apply to do the master's. So they would get the experience and work, have your license from the regulatory body, which is the Nursing Council, and then apply after they have received at least 2 years experience.
Okay, so what are some of the challenges that nurses faced in hospitals or in medical facilities working with other health professionals?
Alright, the challenges, lack of staff, that's one major thing. Lack of staff, lack of equipment to work with, and sometimes the team spirit, you have to have good team members working with, so you can deal with the different challenges that you may face while working on a unit, because we are different persons with different personalities, so you have to learn to adjust to how people are and know that you're working for the greater good of the client.
And usually there is a saying that there's a clash between doctors and nurses. You want to talk about that?
Alright. I know some, maybe that's an inferiority complex, but I know that nursing is a different area, that's a different speciality. So the nurses and the doctors will have to work collaboratively for the patient. Some doctors may feel that yes, they're above the nurses. Yes, doctors get different training, nurses receive different training because they're specializing in different areas. So our training is different from what the doctors receive. So we have to get our training so we can be competent in our area, because we have to work together. So the doctors will ensure that they assess the patient just as nurses assess patient, and then the doctor will write up whatever it is.
So the difference really is in the training and the roles and the responsibilities.
Yes.
Okay, but you do have nurses that can operate as well, right?
Yes, yeah. Well, operates. Well, the nurses, they will work in the surgical area, and they'll work in the theater where they assist the doctors to do the surgery. So they would be like scrubbing in, like the nurse that works in the theater, she will scrub in and pass the instruments while the doctor is actually doing the surgery. So
you don't have any nurse at all that does any form of small operations or?
In doctor's office they may assist, but I haven't really seen a nurse doing like a procedure.
A procedure.
Yes.
Okay.
Unless a
I
doctor.
think I read somewhere that you do have nurses, but it's at a different level of training after you complete your general, that they actually perform smaller
and it depends, and it's depending on the doctors too, because sometimes the doctors, if they're comfortable and know that the nurse is competent, they will maybe be there and guiding the nurse and observing what she's doing.
Okay, so for someone who is sitting out there who is thinking about doing nurses, how many subjects do you really need to have, and what if you don't have some of the subjects? Can something like another certificate suffice? Like for persons I know, they're doing the practical nursing program, and they are being told that if they do the practical nursing program, they can use that to apply to get in for the BSN program. How true is that?
Alright, so firstly let me talk about the latter first. Okay, for persons out there that's doing practical nurse course and they're telling them that it's a transition into nursing, that's not true. What it does is it gives you the experience of working in the field to see if you're able to manage that setting. But it's not a transition from being a practical nurse to a nurse. You have to have your at least 5 subjects: maths, English, and you need a science subject, and they'll give you.
Okay, so just to be clear, you cannot transition from a practical nursing program into the general registered nursing program.
No, you can't transition.
And it's either you have the prerequisites or you consider a next program.
Correct.
Okay. Alright, so just to ask some questions about the examinations that nurses have to do to become a nurse, because from my understanding you're a nursing student and you remain a nursing student until you've passed these exams.
Yes.
So what are the 2 exams that they must pass in order to be called a registered nurse?
Okay, so what we actually have here in Jamaica, we have the spanner duty exam. That's at the end of the 4th year. They have a clinical exam that's governed by the Nursing Council, and they have to pass that. They have 3 attempts at that. And once you're successful in your attempt, any of the attempt, you have the prerequisite to do the RENR, or the Regional Examination for Nurse Registration, and you also have 3 attempts for that as well.
So if you have failed all 3 attempts for the RENR, that's it, you'll never become a registered nurse?
You can't become a registered nurse. However, there's an opportunity which exists for you to become an enrolled assistant nurse.
Wow.
So you have,
And what kind of feedback do you get if you have failed the RENR? Do you get the specific areas that you need to work on, or you just get a regular pass or fail?
well, you get the pass or fail, but if you make an inquiry, you will be apprised of the area that you fail, because the exam is divided in different sections or segments, so you can be apprised of which area you were weak in or the area that you were strongest in, and you can make improvement
In those areas.
Yes.
Okay. And for nursing students, why would you tell them to choose midwifery?
Oh, midwifery. I tell you, I love midwifery. Midwifery is a place to be. That's where you get the adrenaline rush, excitement, everything. And guess what's happening? It's at a point in time where that lady is at her most vulnerable position, where you are there, you can give the best care that you can to impact her life and her baby's life. You're ushering a new life into this world, and the care that you give at this point in time will help the mother and the baby at that time, because frankly the lady is at a state where sometimes I look at it as being near life and death situation, and you can just speak to her and encourage her and just give her that reassurance, and she just listens to what you're saying, listen to your instruction. She's well, baby is well, everybody is happy.
So how do you know if you are, I wouldn't say born, but how do you know that this is an area that you want to be in? As in, how do a nurse decide what specialty they should be in? Is it just based on if they're good at this area, or it has to match like their personality, their career goals, plus being good at it?
Well, personality is good, career goal is also very good, and based on your experience as a student nurse or a nursing student, you go to different areas of the hospital. So when you go to the various areas, you get a liking for the area, and then you can, based on your judgment, when you're there at the area, if you know if you function well there or if you really love it. So based on wherever you were sent for your clinical rotation, if you're loving that area and you're finding you're working well in that area, those are your strengths. You could capitalize on it and pursue your specialization in that specific area.
Okay, and there are several different specialties that persons can choose from when they're actually in the hospital, because you can't choose before.
No, you can't choose before.
Okay.
You have a lot of different areas.
Alright, so if you have any other questions for Mickelle in regards to fertility, maternity and child care, you can drop that in the comment section below. Also, I will leave her details in the description box, so if you want to speak with her privately, you can do so. You can DM me on my social media outlets any questions that you may have. Thank you so much for joining us today, and you do enjoy the rest of your day. But oops, just before we go, please remember to like, share, comment, subscribe. Subscribe, guys. Thank you so much for subscribing so far. Thank you so much for watching. I really appreciate it. Welcome, welcome, welcome to the Chosen Tribe. Thank you for being a part of my tribe, and you do enjoy the rest